So my name's Austin Hayes. I'm a plastic surgeon in Portland, Oregon. This is a classic person who comes in who is looking for a reduction or a lift, I should say. And then whether they want a reduction is variable. Each person is different, obviously. But this is somebody who comes in who doesn't want an implant and wants a lift. So I think many people assume that an implant automatically looks unnatural. And so if they've had the experience of seeing breast implants that they felt were obviously fake, and I'm not saying that's a bad look, it's just not the look that this person wants it's a look that this person wants to avoid, and they think implants, that's what an implant automatically means. And it's not true. There's just so many implant sizes and profiles that people can choose. I tell people if you want an implant, you can have any look you want because you can deproject the implant, you can make it smaller. But, many people, it's just not for them. And I definitely don't encourage implants. People have to want what an implant provides. I mean, there's no reason to do that if it's not really giving true benefit. But yeah, you can see in this photo, this front on photo, that, her breast comes down and totally ends with no hangover. And so, kind of the classic of what somebody says here when they come in is, and everyone is different. So, but very commonly it's, hey, I feel like I need to wear a bra when I'm at home. I don't feel comfortable not wearing a bra. Bathing suit options are limited because my impression is that the tightness required to support their breasts is just more than many bathing suits offer. So what they have, their options are limited. And then it's wearing some dresses you can't wear a bra with, and those dresses are just completely off the table. And so if I hear three things, that's them. That's every single patient basically says those three things. And so, when that's somebody's complaint, breast lift is the solution for that. And so, I feel really confident recommending a breast lift for them because it solves all of the things they're talking about. Now, when they say, hey, in a bra, I'm not big enough, or I've seen your breast lift photos, they're too natural for me. That slope at the top, I just want even more fullness. Well, we know they're probably going to go on and get an implant. But yeah, this result's really, really proud of that. I would say, scars are probably most noticeable around 3 months, but that's, consistent feedback I get is the narrowness of my incisions. So even at 3 months, they're very narrow, but they're very red at 3 months. And then they'll taper off and fade over time. It takes a scar about a year to mature. But the scar is meant to be, double bra actually I think makes the scars heal better down in the fold because the way it's sewn, it essentially takes tension off of the incision. So it has all of these benefits, but a finer scar is one of them. But yeah, the incisions are really fine. The best place to find me at DR and then my name, Austin, Austin, Hayes, Hayes. That's my Instagram.